How do ventilators help with severe flu? When the flu hits hard and causes serious breathing problems, ventilators can be lifesavers. They step in when the lungs are too damaged to do their job properly. Severe flu can lead to complications like pneumonia, which fills the lungs with fluid, or acute respiratory distress syndrome, where the lungs become inflamed and stiff. These conditions make it hard for oxygen to get into the blood and for carbon dioxide to leave the body. Ventilators support or fully take over breathing to keep oxygen levels steady and remove excess carbon dioxide. The way ventilators help is by mechanically delivering breaths into the lungs. When the lungs are inflamed or filled with fluid, they can't expand fully or exchange gases effectively. Ventilators use controlled oxygen and pressure to ensure the patient gets enough oxygen and that carbon dioxide is expelled. This support is crucial because it compensates for the lungs' reduced ability to do their job naturally. Another important role of ventilators is preventing the muscles used for breathing from becoming exhausted. When someone struggles to breathe, those muscles work harder and can tire out. Ventilators reduce this effort, giving the muscles a chance to rest and recover. This is especially helpful in severe cases where breathing is labored and inefficient. Ventilators can also provide positive pressure during exhalation, known as positive end expiratory pressure. This keeps the tiny air sacs in the lungs, called alveoli, open. Keeping alveoli open improves oxygen exchange and prevents lung collapse, which is common in pneumonia and acute respiratory distress syndrome caused by the flu. Supporting breathing with a ventilator also allows doctors to focus on other treatments. While the ventilator maintains oxygen levels, antiviral medications and antibiotics can work more effectively against the virus and any secondary bacterial infections. This coordinated approach can improve recovery chances. In the most critical cases, when ventilators alone can't keep oxygen levels up, a more advanced support called extracorporeal membrane oxygenation may be used. ECMO takes blood outside the body, oxygenates it directly, and then returns it to the patient. This gives the lungs a much-needed rest and time to heal. Research shows that early and appropriate use of ventilators, sometimes combined with ECMO, can significantly improve survival in severe flu cases. They are a key part of intensive care for patients with life-threatening respiratory failure. Overall, ventilators help ensure that even when the lungs are severely compromised by the flu, the body still receives enough oxygen to keep vital organs functioning. Always remember, ventilator support is a medical decision made by healthcare professionals, tailored to each patient's needs, and used in a hospital setting under close supervision. If you or someone you know is facing severe flu symptoms, seeking prompt medical care is essential for the best outcome.